Neurological consequences after portosystemic shunt attenuation in cats, a meta-analysis study. Introduction. The article addresses a critical topic in feline medicine: neurological outcomes after portosystemic shunt, PSS, attenuation in cats. A congenital portosystemic shunt, CPSS, is an abnormal vascular connection that diverts blood from the portal vein directly into the systemic circulation, bypassing the liver. This condition leads to hepatic encephalopathy where toxic metabolites accumulate in the bloodstream due to the liver's inability to process them. CPSS can be either intrahepatic or extrahepatic, with extrahepatic shunts being the more common type in cats. Surgery to correct the shunt is the most effective treatment, but complications arise postoperatively, including neurological issues such as post-attenuation neurological signs PANS and post-attenuation seizures PAS. These can severely impact outcomes, and in some cases, mortality is associated with these conditions. The aim of the study is to compile and analyze existing data on PANS and PAS, particularly focusing on prevalence, risk factors, and postoperative outcomes. By doing so, the authors hope to provide insights into the underlying causes and suggest potential strategies for managing these complications in feline patients. Search strategy. To conduct a comprehensive meta-analysis, the authors adhered to the MOOS, Meta-Analyses of Observational Studies in Epidemiology procedure, which outlines best practices for performing systematic reviews and meta-analyses. The study design involved a thorough search across several major databases, including PubMed, Web of Science, ScienceDirect, Embase, and Scopus, covering literature published up until December 2023. The researchers utilized a combination of medical subject headings terms like PSS, PENS, PAS, and feline surgery, applying Boolean operators to refine their search and identify relevant studies. The search yielded 664 articles, but after filtering for duplicates and exclusion criteria, e.g., conference abstracts or small sample sizes, the final dataset included 12 high-quality studies. The studies included in the meta-analysis spanned from 1993 to 2023 and focused on both congenital intrahepatic portosystemic shunts, CIHPSS, and congenital extrahepatic portosystemic shunts, CEHPSS. Various surgical techniques for shunt attenuation were included, such as complete ligation CL, partial ligation PL, thin film bending, TFB, and the use of amyloid constrictors AC. Results, pooled prevalence and mortality rates. The results section discusses the prevalence of PANS and PAS in cats after shunt attenuation surgery. The analysis was performed using a random effects model due to the significant heterogeneity among studies. The overall prevalence of PANS was 38.9%, 95% CI, 27 to 50.9%, and for PAS, the prevalence was 20.2%, 95% CI, 15.3 to 25.1%. In terms of mortality, the rates were 17% for PANS and 37.2% for PAS. These mortality rates highlight the severity of post-attenuation neurological complications, particularly for seizures, which carry a higher risk of fatal outcomes. Shunt attenuation techniques. Among the various shunt attenuation techniques, complete ligation CL had the highest prevalence of both PANS, 52.4%, and PAS, 25.5%. Partial ligation PL and delayed attenuation techniques DAT, which include amyloid constrictors and thin film bending, had slightly lower prevalence rates for PANS and PAS. However, the differences between techniques were not statistically significant, indicating that neurological outcomes may not be heavily influenced by the surgical method used for shunt closure. Shunt morphology. Regarding shunt morphology, CEHPSS was associated with a PANS prevalence range of 26.8% to 56.5%, while CIHPSS had a range of 26.3% to 54.3%. For PAS, the overall prevalence was higher in cats with CIHPSS, 31.7%, compared to those with CEHPSS, 16.8%. This difference suggests that intrahepatic shunts may pose a greater risk for postoperative seizures, but further research is needed to confirm this trend. Discussion: neurological outcomes and potential causes. Post-attenuation neurological signs PANS. PANS are typically observed within 96 hours post-surgery and can range from mild symptoms like ataxia and blindness to more severe outcomes, including seizures. The exact pathophysiology of PANS remains unclear, but several theories have been proposed. 1. Ammonia metabolism. One theory links PANS to changes in ammonia metabolism. Preoperative ammonia levels are often elevated in cats with PSS due to hepatic encephalopathy. However, some cats with normal ammonia levels postoperatively still develop PANS, suggesting that ammonia alone may not be the sole trigger. 2. Cerebral edema. Another theory proposes that cerebral edema following rapid changes in osmolality during surgery may contribute to neurological complications. The brain may struggle to adjust to the altered vascular environment post-shunt attenuation, leading to edema and subsequent neurological signs. 3. Benzodiazepine-like substances. There is also some evidence suggesting that benzodiazepine-like substances accumulate in the cerebrospinal fluid CSF of cats with PSS, potentially contributing to PANS. These substances act on the central nervous system and may exacerbate neurological symptoms following surgery. Post-attenuation seizures PAS, while less common than PANS, are a more serious complication due to their association with higher mortality rates. These seizures often occur in the immediate postoperative period and may not respond well to conventional antiepileptic drugs (AEDs). The study highlights that benzodiazepines, phenobarbital, and even propofol CRI have been used to manage PAS, but outcomes are variable. In severe cases, euthanasia is sometimes considered due to the intractability of seizures. Risk factors. The study identifies several potential risk factors for the development of PANS and PAS, although the exact causes remain elusive. Preoperative ammonia levels. Cats with higher preoperative ammonia concentrations were more likely to develop PANS, suggesting a link between preoperative hepatic encephalopathy and postoperative neurological outcomes. Age and shunt type. Older cats and those with intrahepatic shunts, CIHPSS, appeared to have a higher risk of PAS, although breed and gender did not seem to influence outcomes significantly. Electrolyte imbalances. There was no strong evidence linking PANS to perioperative electrolyte imbalances, although further research is needed in this area. Postoperative hyperkalemia and hypocalcemia are occasionally reported but not consistently associated with neurological outcomes. Preventative strategies. Given the high prevalence and serious nature of PANS and PAS, the study calls for the development of preventative strategies. The use of preoperative AEDs like levetiracetam or phenobarbital is mentioned, but the evidence supporting their efficacy is limited. The study suggests further investigation into preoperative ammonia management and osmotic control during surgery to mitigate the risk of neurological complications. Conclusion. This meta-analysis provides a comprehensive overview of the prevalence and risk factors associated with post-attenuation neurological signs, PANS, and post-attenuation seizures, PAS in cats following portosystemic shunt surgery. The high prevalence of PANS, 38.9%, and the elevated mortality associated with PAS, 37.2%, underscore the importance of addressing these complications in clinical practice. The study highlights the need for more research into the underlying mechanisms of PANS and PAS, as well as the development of standardized treatment protocols to improve outcomes for cats undergoing shunt attenuation surgery. While surgical technique and shunt morphology do not appear to significantly influence neurological outcomes, other factors such as preoperative ammonia levels and perioperative management may play a critical role in preventing these complications. The findings from this study will help inform clinical decision-making and treatment planning for veterinary surgeons dealing with feline portosystemic shunts, ultimately improving the prognosis and quality of life for affected cats.